Hello, my name is Shilpa Krishnan. Today I'm going to present my study titled Characteristics and Rehab Utilization of Pre-existing Superficial and Deep Pressure Injury among Stroke Elderly Admitted to Skilled Nursing Facilities. Older adults with stroke in skilled nursing facilities are at a greater risk to develop pressure injuries than their younger counterparts. Studies have shown that individuals with pressure injuries have lower function and are institutionalized to long term care than those without pressure injuries. The current clinical practice guidelines for pressure injury management fall within the scope of practice of rehabilitation professionals that include physical therapists, occupational therapists, and restorative nursing staff. However, there is a gap in evidence on the comorbidities and utilization of rehabilitation among individuals with stroke with pre existing superficial and deep pressure injury. For our study, we defined superficial pressure injuries as stages 1 and 2 and deep pressure injuries as stages 3, 4, unstageable, and deep tissue injury. This study utilized a retrospective secondary data analysis using the Medicare Minimum Data Set of Skilled Nursing Facilities, that is MDS 3.0. We included the time period between 2013 to 2014, and individuals were included if they had stroke and age 66 and older. Compared to superficial pressure injury, individuals with deep pressure injuries were young old, less than 75 years, were non Hispanic blacks, had a lower socioeconomic status, had a shorter length of stay in acute care, had stayed in an intensive care unit, and had higher level of physical and cognitive impairments. Individuals with deep pressure injuries were more likely to present with anemia, malnutrition, urinary and bowel incontinence, renal failure, end stage renal disease, infections such as pneumonia, complicated and uncomplicated diabetes mellitus. Individuals with deep pressure injuries were more likely to be on a pressure reducing device, had nutrition or hydration treatment, non surgical dressings, ointments or medications, and dressings to the foot compared to superficial pressure injuries. Of note, individuals with deep pressure injuries were less likely to receive individual physical therapy and occupational therapy minutes in skilled nursing facilities. In conclusion, individuals with deep pressure injuries had more comorbidities compared to individuals with superficial pressure injuries. It's important to identify modifiable risk factors to prevent pressure injuries that will further allow for targeted prevention interventions. Improving the utilization of physical therapy and occupational therapy in skilled nursing facilities represents a potential target for improving quality of care. Patients with stroke having deep pressure injuries may develop infections that may force them to remain in isolation to prevent the spread of infection, which may decrease their utilization of rehabilitation. Increasing social isolation because of pressure injuries may increase the risk of cognitive symptoms, including depression. I would like to thank the funding source, and please contact me if you do have any questions.